Welcome back. As the coronavirus pandemic grows, thousands of Americans have been hospitalized or have died from breathing problems. Now, I-Team investigator Adam Walser finds Florida could face even greater challenges because the state already has one of the highest rates of hospitalizations for vaping-related lung injuries.
As the coronavirus pandemic unfolds day by day, it's easy to forget that the CDC opened a different emergency response center less than 7 months ago for deaths and illnesses caused by vaping. Some doctors now worry people who use e-cigarettes face greater danger.
It is causing things like scarring and inflammation in the lungs, which is the exact setup of a patient who could potentially have a much worse outcome if exposed and if they develop COVID-19.
Tampa Dr. Lisa Coach says research directly linking vaping to coronavirus is not yet available, but she believes vapors face a higher risk.
Clearly, a smoker or a vapor is going to have a higher incidence, as are, my asthmatics that are maybe poorly controlled or other patients with primary lung issues.
The CDC says 2,800 people were hospitalized and 68 died from vaping since 2019. In Florida, there were only 2 deaths, but the state is in the top 11 across the country for vaping-related lung injury hospitalizations. And a recent state survey showed 25% of high school students regularly use e-cigarettes, up 62% in just 5 years. An alarming trend called out by Florida's top prosecutor.
Government must act quickly and with purpose and with urgency anytime we see a rapid rise in addiction, which turns into an epidemic.
There's been little regulation of the e-cigarette industry so far, and many e-cigarettes contain unknown chemicals produced overseas.
They're not just magically leaving your body.
2 identical samples of these.
The I-Team recently participated in an ABC News investigation involving more than a dozen stations nationwide.
This one says 6% nicotine.
We bought e-cigarette cartridges from multiple local stores, then shipped them to a lab where they were tested for nicotine levels. The results varied widely, some up to 50% less than advertised on the label, revealing a lack of standards and regulation in these products. Michael Cherub owns South Tampa Vape Shop and started vaping 6 years ago after quitting cigarettes. He says he's not worried.
There's no evidence either way concerning being more susceptible to COVID-19 because you vape.
Cherub says his liquids come from trusted U.S. sources, and he believes the people injured by vaping used black market products. As for what his customers are saying,
they haven't expressed any concern about it other than being able to get their products.
But Dr. Coach says people who smoke and vape should be worried.
You're putting toxins into your body that are going to age you. You're causing generalized inflammation, and you're making yourself much more prone to not only crazy things like this COVID-19 infection, but all types of chronic diseases.
I'm I-Team investigator Adam Walser taking action for you.